My name is Sue Egan. I'm a nurse practitioner, and I've been with the VNA Hospice for 15 years. My primary responsibilities are to help the nurses. We focus on comfort. We focus on any problems that arise for the family or the patient during their course of illness. Our goal is to make every day as good as it can be for the patient and the family and anybody who's traveling to see them. So this takes a whole team to coordinate this care. The nurses, 24/7, they are amazing. We're not just focused on pain, we're focused on quality of life. We want their days to be good. And as many as they have, we're there to help them have them. Once they're on hospice for 6 months, I start to see them every couple months and make sure they still qualify for services. Things are going well for the families and the patient and the nurses, and see where I can fit in to help. We look at symptom management, we look at what's changed over the past 2 months, we look at med changes, we look at treatment protocols, anything that interacts with their course of care, and that goes into the recertification process. Hospice isn't necessarily your last stop. Sometimes people come out of the hospital very ill and very deconditioned and weak, and we think, we're not sure what the course of care is going to involve. And we come in and we meet them where they are at that time in their illness. Well, we work really hard to discharge only patients that are really ready for discharge, or they've made the decision, or the family's made the decision to discharge. Some patients revoke to seek treatment. They decide they're feeling better. We have young and old. You have a 40-year-old guy who hears about a new trial. He may want to take advantage of that. There's no restrictions to hospice. You can go out to dinner. You can travel. We have travel contracts with different hospices all over the country. You can fly. We want you to live your life. If that's getting your granddaughter's wedding in Maine, we facilitate that. We still have patients that go and see their PCPs. We don't seek treatment, but if a person needs to talk to their PCP about something, that option is always available to them. We go anywhere, from the tip of Provincetown to Sagamore to Buzzards Bay to the islands. There's all different living situations in our community. Assisted living, we have nursing homes, we have memory care centers, the patient's home itself. Sometimes there's a new home, a daughter's home, or a grandson's home, so we have to kind of adapt to that too. Well, I think one of the things that differentiates VNA Hospice is McCarthy Care Center. This service that's available to our patients, both in the hospital and in the community, is vital. Sometimes the pain's too great and they're just not kept comfortable at home. They may need IVs, and that all happens at McCarthy Care Center. It's an amazing service. It's an amazing place. They do amazing work. They meet the patient where they are, and they get them comfortable. I think the history of the VNA differentiates us. I think it's a long-standing institution. I think people are familiar with it. We're continuity. We've taken care of multiple family members. It's history. A lot of times we'll, get a patient and they'll say, you took care of my mom or my dad or my sister or my brother. And I think that continuity for families is really important. I'll always go back to the nurses. They're amazing. The community knows them. They work in the community. They volunteer in the community. They give constantly. It's an honor. I think the best word to describe it is an honor. We're all going in the same direction. We're all going to need help at the end of our lives. And I hope I live my life the way I want to be treated at the end of mine. It is a spiritual journey. Every day you get up and you have to kind of forget what you're going through, because there's always somebody that needs something more. And I think most of us would say that it fills our heart. Our patients teach me something every day. We want to be there. That's why we chose this career, We want to be there for our patients. So when you walk into a room, walk in open-minded, walk in willing to help, walk in to make their day a better day.